Hey guys, it's Action Against Anxiety, back with another video about GAD, and basically this time we'll be talking about how it's diagnosed. So let's get started. So what is GAD? So in a normal scenario, if you're giving a presentation in front of a lot of people, you might feel stressed, right? That's completely normal. And afterwards the stress would normally fade away. You'll be like, hey, I nailed it. That wasn't so bad. Done in most scenarios. But in generalized anxiety disorder, if you have it, and that would mean you're a small percentage of the population, the stress doesn't go away. In some cases, it's always there, and many times for no reason at all. This is known as anxiety and is correlated with general anxiety disorder. So that's basically what generalized anxiety disorder is. And specifically in this video, we're going to be discussing how it's diagnosed by doctors, therapists, anybody that can diagnose this. There's this little like checklist that they have to follow to diagnose it, and that's what we will talk about. Um, but generalized anxiety disorder also has like an official definition, which if you like search up online or go to many trusted websites, this is what it's gonna show you, or something similar to this. So the definition is excessive, persistent, and unreasonable anxiety symptoms, including the individual believing that these are out of control feelings. So the individual would believe that all these feelings are basically out of their control, and generalized anxiety disorder involves a lot of anxiety symptoms. That's basically what it is. So some general guidelines for diagnosis. Number one, it needs to be excessive. So if it lasted for 180 days, it needs to be present for greater than 90 out of those last 180 days. If it's not like that, then it's likely not GAD and it's something else, or it's just normal anxiety. It's hard to control anxiety. So it's hard to calm and self-soothe yourself if you have this like normal anxiety. It's annoying as hell, but there is a way to calm yourself and get back to normal. But generalized anxiety disorder, it's much harder to do that. So something related to symptoms, adults commonly have greater than 3 symptoms, and minors just need 1 symptom to get diagnosed. So these aren't really symptoms that we're talking about here. These are the guidelines for diagnosis. Symptoms we'll discuss in a different video, but yeah, so um, that's the amount of symptoms each age group needs to have. There needs to be an impairment in daily life, so it must be very difficult to do daily tasks. Um, Normal anxiety would already make it difficult, but this would make it even more difficult. This is not attributed to drug abuse or a condition. This is not related to like a drug abuse symptoms or excessive hormones like hyperthyroidism. Um, so hyperthyroidism is basically a condition in which you have excessive hormones, and that would give you a lot of excitement and energy. Um, it's in a small percentage of the population, and it's very inconvenient in daily life. But this if you have GAD, it doesn't really relate to that much. That would be if you have that, the doctor would diagnose you with hyperthyroidism, not really GAD. So it's a bit different. They have to be a little different. And it's not explained better by another mental disorder. So other mental disorders like social phobia or panic disorder, they cannot explain GAD better than GAD can explain it, or whatever that's going on with you. And all of this could be found through the Diagnostic and Statistical Manual of Mental Disorders, which is also specifically in the DSM-5. This is basically how mental disorders are characterized, and just basically like how you would diagnose mental disorders. This is what doctors and therapists and psychologists use. And you're not it's like not 100% necessary to have all of these to have GAD, but these are just the general guidelines that doctors should follow when diagnosing. That's basically it. If you have any questions, you can email us at action.anxiety. No, I was messed up. At action.against.anxiety.sfhs@gmail.com. Hope you enjoyed the video and have a great day. Bye.